Now, I know that a lot of medicine is basically based and predicated on a patient waiting till something occurs, they become diseased, ill, and then they go in. And I do believe that the community model is a great one for chronic illness. Do you think it could be applied to preventive medicine as well and health optimization? Because, if we really want to get ahead with this and turn this around, it's not just about reversing disease, it's getting ahead of it. It's saying, let's not get disease in the first place and let's start to prevent it. But as we are now, most of medicine is just like, wait, it's basically saying you don't need to come in till there's something wrong. Do you think this model can be applied to a preventive kind of proactive stance?
For sure.
Yeah.
So I would say, just to like open the kimono on the plan, ultimately there's most health systems in America, 70% still operate on a fee-for-service model, right? Where you bill insurance for everything that you do. And I think all of us could probably think that that's not a great model because it incentivizes the wrong thing, doing too much stuff. And it doesn't incentivize you to actually make anyone healthy. It just encourages you to do more stuff. But that's the way that it is. And I spent a lot of time before thinking about, well, how could you change that? And I don't know if I can change it. There are certainly people who are doing an amazing job. Look at groups like Hint Health that have basically a countrywide network of doctors that do like a membership model that has much better incentives. So there are people that are doing cool stuff in that regard, but I didn't know if that was on me. So the plan right now is that we ride the wave and help entities essentially deliver this group's lifestyle medicine in a profitable way on fee for service and essentially build up our technology and build our capacity and build the scalability and the delivery system of it. There is another wave that is happening in healthcare that speaks to exactly what you're saying. There is a shift happening now. It represents 30% of healthcare where people can get paid more if you keep people healthier for less. Right. So that's coming. It's called value-based care. It's pretty boring. It's been coming for 10 years. It's pretty slow, but it is starting to accelerate. And so you're starting to see like what they call capitated models where basically they say, okay, we're only going to give you X amount of money and you have to work out how to do it. And therefore, if you can keep people well at the minimum possible cost, you win. And the medium-term thesis for Heal Community is that we will have with Heal Community, as we get to scale, the most efficient system that could ever be created for keeping people healthy at the minimum possible cost. Because over time, yes, there will be health coaches, but over time, that might actually turn to actual peers, right? We've done a lot of testing thus far on like peer-to-peer coaching, right? So you and I could be in a group and we're not trained as health coaches, but if I can support you in your journey and you can support me in my journey, and it doesn't cost either of us anything, it's pretty awesome. And so, that's kind of where we're headed. And to try and work out that now takes a lot of like iterations, probably some machine learning, to really understand like how do we maximize the relationship between two people, between a person and a group. But that's sort of where we're headed. So the goal is, can we create a system that is designed from its very initial essence to help people support each other in doing the basic healthy behaviors. Now, that won't reverse everyone's chronic illness, right? But it will take a pretty big chunk out of it.
It'll definitely take a big chunk out of it.